Nita, can you check the advancing on here? The next slide is going to tell you a little bit about myself. I'm a 1985 St. Augustine High School graduate.
Yellow Jackets.
And then I went to Miami-Dade Community College. And then I went to the Palmer College of Chiropractic in Davenport, Iowa. Graduated from there in 1992. So we're going on 30 years of practice. So it'll be 31. And then I got a specialty in chiropractic neurology. So what is that? That's a specialty within chiropractic. It's a 500-hour program to sit a board exam. And so it's diagnosis of things of the brain, spinal cord, and nerves. But rather than use prescriptions or surgery, we find holistic ways to correct things. So there's different types of nerve cell injuries. One's called physiological, meaning the nerve's not cut, okay? So there's a chance for it to heal and work better. So that's called a physiological lesion. And then there's ablative lesions, which is like a tumor or something's actually cut through the nerve. It's harder for a chiropractor to help with. But it allows us to determine which one you have and whether we can help or not. So we can help a lot of neurological cases that don't need surgery. And then I became a specialist in scoliosis in 2015 and an advanced specialist in 2016. And then in 2017, we became a Scoli brace provider, which is a specialized three-dimensional brace that helps to help adolescent scoliosis as well as adult degenerative scoliosis. So what do you think the USA is ranked today in overall health? There's about 200 countries in the world. Any guesses?
Near the bottom.
Yeah,
37.
Oh,
So we agree we should be a lot higher than that.
Right.
Yep, we should be number one.
Yeah.
I always like the USA Olympics when we beat the Russians in ice hockey
Yeah.
in Lake Placid. Everybody's USA, USA, right? We should be number one. I heard did we beat Iran in soccer?
1-0.
Okay, we'll take it.
Going to the final 16.
Hey, I'm impressed that they're allowed to play soccer. You know, Iran. I was kind of surprised by that. And I noticed that the World Cup in Qatar, when you see the the videos like leading into the games at each one, they very carefully have a girl and a boy playing soccer. You know, because we know that in some countries girls can't play soccer, you know, in a lot of Middle Eastern countries. What do you think the world is ranked in infant mortality?
I'd say it's pretty low. Oh, morbidity or, I'm sorry, mortality.
Yeah, so number one would be the healthiest country, the least amount of deaths when for childbirth. 200 would be the worst.
I think we're better than health.
Yeah, I would say so.
That's what most people think, 52nd. So why is that? So you think we have a lot of medical interventions, right? But the problem is birth is already something that's perfect. So if you try to improve on perfection, you only make it worse. So third world countries have a higher infant mortality rate or a better infant mortality rate than us because a lot of things we do are complicating something that's already perfect. So if you look at like cesareans, for example, you can look at populations where there's a lot of wealth in the United States and they have a super high cesarean rate. So like if you looked at San Francisco or New York or Chicago, Los Angeles, the cesarean rate is real high. But if you look at somewhere like Iowa, it's super low. Does that make any sense? It doesn't make any sense. I mean, if you need it,
it does. Like the bigger the city and stuff.
But if
more
you
people,
need a
more
cesarean, it should be the same everywhere.
Well, I mean, people can afford it though. I mean,
No,
out there now,
but you should
out
only
there.
have it if it's necessary.
Yeah. I don't think that's what it is. I think in Iowa they have a lot of insurance, meaning but the people just aren't into having cesareans, and the doctors aren't into giving them. But when you look in a lot of with like socialized medicine, a lot of these cesareans are not paid for by the person that's getting it. So it's not a matter of wealth, it's a matter of trends. It's just a popular thing to do. Just like medication. You can look at medications prescribed for different conditions and you'll see the same thing. There'll be like a city and the drug will become popular in that city and it'll be prescribed a lot in that area. And then you'll look at another area and they're not prescribing that drug. If it's only based on what's wrong with the person, you shouldn't see those kind of trends, right? So that's part of the problem. So over 1 million mothers, daughters, fathers, sons will die from heart disease and cancer this year. Would you agree we need to make some major changes in the way we approach our health? Obviously, we're doing something wrong, right? So there's 5 attitudes that prevent us from being healthy. 1, it's out of my control. 2, it's normal to get sick. 3, disease makes us sick. Only see the doctor when you're sick. It's expensive to be healthy. These 5 attitudes prevent us from being healthy. So the first one is it's out of my control. Well, we can't blame our health problems on our parents because less than 1% of all diseases are related to genetics. Most diseases are related to our habits, things that we do every day to determine whether we're healthy or not. Are drugs the answer to humanity's problems? Well, our country consumes more drugs by volume than any country in the world, yet we're ranked 37th. If drugs were the answer, we should be ranked number 1, right? All drugs cause side effects. So you take a drug for one condition, it's going to cause another problem. And I had a guy work for me one time that ended up on 16 different medications. They checked him into the hospital and they had a groundbreaking new therapy that they were trying on people like him. You know what they did? They put him on an IV solution and took him off all the medications and left him in a hospital bed. Guess what happened? He got better. He got hydrated and he had no drugs in his system and he got healthy. It was a groundbreaking research study that they did. Prevention versus crisis. If we bought a new car, drove it as hard as we could, never did any maintenance, never changed the oil, eventually that car would blow up. If it blows up next to a new car dealership, you can walk out of the blown up car and just get a new one and drive off, right? But you can't do that with your body. You got to take care of your body. You don't have an alternative. They haven't figured out how to do a brain transplant yet.
Right.
So you better take care of yourself. You better practice prevention. What are symptoms? Symptoms are merely the result of the body being out of balance and alerting you to a problem within. Symptoms serve as a warning that something needs to be explored and changed in one's life. Illness is a message. Dennis Jaffe, PhD. So if a fire alarm goes off, you wouldn't cut the wire from the fire alarm. You'd find out what was going on, right? But a lot of the medications we're dealing with, they're just covering up symptoms. Even some surgeries, like people that have chronic pain, they do what's called an ablation or a rhizotomy. And what they're doing is they're taking a laser or sometimes even a knife and cutting the fibers right before the pain fibers come into your spinal cord. But what happens is the body regrows extra fibers around where they cut or burned it. And then you have twice or 10 times as many pain fibers. So it works for a little while, but then it creates more problems down the road. If you ever try to bypass a natural cycle, there's a price to be paid somewhere later on. Second attitude is it's normal to get sick. Is it the seed or the soil? Well, first of all, it's not normal to get sick. And I want to talk about something. Last night, somebody asked me about a steroid injection. They were having some tennis elbow, and their elbow was inflamed. And would steroids help the pain? Yes, if you got an injection in there, chances are the pain will go away. For some people, it will go away permanently. Other people, it'll go away lesser time. Other people won't change at all. But in any of those 3 examples, none of them got to the root of why the tennis elbow developed in the first place. There was a reason for it, right? We want to get to the cause of the problem. But steroids, there's an accumulative effect in your body. So every time you take it, it suppresses your immune system, and it'll cause osteoporosis and degeneration. So there's a classic textbook on the neck, and they show an x-ray taken every 10 years on somebody, and every time they came to the doctor, they got a steroid injection, and every single time the pain went away. So over like a 50-year period of time, you have these 5 x-rays. Well, by the 5th x-ray, the person's neck was totally fused because of the effect of the steroid on the bones. Is it the seed or the soil? Well, there's plenty of people that have great genetic potential that don't amount to anything. And then you have other people that don't have as much genetic potential, but they have a better environment, and then they actually come out ahead of the person with the great genetic potential. So it's this, the soil is very important. It's not just about the seed. Third attitude, disease makes us sick. If we see the word disease here, see how it's hyphenated? Hippocrates talked about health as ease. So perfect health would be everything's in balance and at ease. Disease is when things start to get out of balance with the hyphen. And then disease without the hyphen is when you can see things under a microscope. There's pathological processes going on. It's gotten really bad. So disease is lack of harmony inside the body. We spend billions of dollars studying disease and virtually nothing on health. If you focus on disease, you get disease. If you're constantly studying disease, you know, in like 1972, President Nixon declared a war on cancer. Ever since then, the cancer rate's gone up. So, I mean, so they should focus on people that don't get cancer, and let's do what those people are doing, and maybe we'll get better luck, right? Mother Teresa was asked to speak at an anti-war rally, and she wouldn't do it. People got all upset. And she said, well, if you have a pro-peace rally, I'll speak at that one. So she was onto that. How life begins. 2 weeks after fertilization, the primitive streak is created. This will become the central nervous system, master system, controlling every other cell, tissue, and organ in the human body. So we have our central nervous system, everything grows off of that. The baby is protected by a fetal curve and amniotic fluid. So if the mother falls, it's like a spring between the fluid and this curve that protects the baby. Now when a baby's born, you want to maintain them in that fetal curve. There's a famous book by a French OBGYN called Birth Without Violence. And he talks about how in a medical birth, we take a baby that's been in a dark womb, lay them flat on their back, drop silver nitrate drops in their eyes, and flash some light in their eyes and say, hey, welcome to the world. And then we wonder why the baby cries. So with scoliosis, what we know is the better you maintain this fetal curve, the less chance you have of getting scoliosis. So when you see moms wearing these slings, right, that's maintaining that fetal curve. So you should let the baby come out of that fetal curve slowly. Then when the baby lifts their head up in 6 to 12 months, or 3 to 6 months rather, that's the tummy time. It's like a genetic thing that's built in the body. It's an innate thing. And so you just put a baby on their stomach when they're 3 months old, they'll start doing this, right? They're developing the curve in their neck. It's a normal maturation that occurs. Then at 6 to 12 months, when they crawl, they develop the lumbar curve, right? Now we have these 3 curves in our spine, and that's what gives our spine strength. And then after we crawl, then our spine's more stable and we're ready to stand up and walk. Now, if we don't follow those steps, then you're more likely to have learning disabilities and scoliosis because you've missed these natural steps. So with my grandson, he's like trying to walk, but I'm constantly making him crawl, you know? So his mom will say, you're treating him like a dog. What are you doing? Because I'm like, get him crawling, throw something over here, make him crawl across the room. Because you want to make him crawl rather than walk. You don't want to use the front packs, the Johnny jumpers, the saucers. The saucers create a whole nother thing because kinesthetically, they can't see their feet. So that develops other issues, spatial issues with the brain because they're walking, but they can't see their feet. So there's some issues with that too. So we want to have these three curves as an adult. If we don't have them, they either didn't develop after you were born, or you got into an accident or something like that. Defense against germs. There's no magic bullet, instant gratification, or miracle cure against viruses or bacteria. There's only increased internal resistance from hard work, nutrition, exercise, rest, and positive mental attitude. The central nervous system controls the 5 systems of the human body: glandular, elimination, digestive, musculoskeletal, circulatory system. So the brain controls all these other systems in the human body. Gray's Anatomy states the central nervous system controls and coordinates every other cell, tissue, and organ in the human body. So all the healing occurs from above down, inside out to all the cells and tissues of the body. Your body's 98% new every year. Dallas, do you still have to get your hair cut?
Mhm.
Yes. Rob, do you get your fingernails clipped?
No. Yeah.
Never? You get a haircut.
Yes.
Okay.
Yes.
Your body's pushing out new cells.
Okay.
That's the point of it, right? And then we want those cells to be as healthy as they can. So are they regenerating or degenerating? So if you look at somebody's body in a 3 to 7 year period of time, they've replaced all their cells, but are they better than the ones that were there before? Even a spur on X-ray got replaced. Even cancer got replaced. But are those cells healthier than the ones that were there before? So that's what health is. That's what our goal is. Guidance physiology states the autonomic nervous system is the major system controlling the mechanisms of homeostasis. Homeostasis is our body's ability to adapt to the environment. So, Dallas, is a fever good or bad? Bad. Well, if you have an infection and you get a fever, which the high temperature will kill the infection, that's good, right? I'm thinking about going to get some oysters tonight. If I have a bad oyster and I start throwing up, is that good or bad?
Bad.
No, it's good.
What?
Getting
Do
rid
you
of it.
want that?
Doesn't
Well, you don't want that rotten oyster in your stomach.
Well, no.
It's gonna make all kind of bad things happen, right? So your body has this mechanism to do the right thing. It's gonna get rid of it, right?
Right, okay.
So if we have an infection and we get a fever, our body's killing the infection. That's good. It's a natural response. It's called homeostasis. Our body's adapting to the environment. So that's good.
Throwing up's good. God.
Subluxation is a bone out of place interfering with a nerve. That's what we're seeing right here. We see the word silent decay there because 90% of your nervous system has to do with controlling and coordinating all your bodily function. Only 10% has to do with pain. So we can have things degenerate over a long period of time, not necessarily cause any symptoms. They can cause a lot of things to go wrong, and then all of a sudden one day we pick up a paper clip and we can't move, right? Or we sneeze and we can't move. And then we think, what did I do? Well, you didn't do that much. It was like the straw that broke the camel's back kind of thing. Your body is like a garden with proper raw materials and no interference. You will regenerate and be healthy. Healing takes time. So the hose is like the spinal cord, the sprinkler is like the nerves, and the roses are like the organs. So if we have a rock on the hose, then or a bone on the nerve, then the organs of the flowers are going to degenerate. If we take the rock off the hose, then things are going to heal. Subluxation distort the structure of the spine, reducing and eliminating curves, therefore altering the biomechanics of the spine. Research shows when this happens, you create a degenerative process that always goes to completion. So we have these normal curves like we talked about earlier, and that gives our body strength. If we don't have those, it's going to degenerate. Our body's going to degenerate every time. Just like if this bridge didn't have this arc, it would collapse. Same thing would happen with our spine. They did a study with 100 cadavers called the Windsor autopsies, and they found that everybody had some pinched nerves, that wherever those nerves go to the organ, those organs start to not work properly. The worse the pinched nerve, the more serious the organ damage. So if you have a pinched nerve, you want to make sure you get adjusted, allowing your body to regenerate and heal. Why do you go to a chiropractor? To get adjusted, correcting and preventing subluxations. Subluxations are... Any guesses? Okay. Subluxations are when the bone is out of place, interfering with the nerve. That's what a subluxation is. This is a patient that came in when they were 52 years old. They had neck pain, shoulder pain, mid-back pain, low back pain, numbness and tingling down the left arm, depression, migraines, high blood pressure, anxiety, insomnia, tinnitus, and acid reflux. Work had become difficult. They no longer could walk or hike due to pain. They rated quality of life as 3 out of 10. They're on pain medication and blood pressure medication every day. And like I said, they just received their first chiropractic adjustment at age 52. Their head's forward. They have a reversal of the curve in the neck. They have disc degeneration, bone spurs. The cord is stretched because of the position. Every inch your head's forward, it feels like it weighs another 10 pounds. So their head's going to feel like it weighs 10 pounds more than it normally should. This patient had a healthy spine, no pain or conditions, works full-time, walks 2 miles every morning, pain-free, rates quality of life as 10 out of 10. They're on no medication. They do take chlorella, which is a compressed algae that has all your vitamins, minerals, and protein in it. It also helps with your alkalinity. Many times when you're in pain, your body's more acidic. It will cause more of a painful environment. They received corrective chiropractic care at age 26, and they've had at least a monthly maintenance adjustment every month since then, and they're 55 years old. This patient, the head's half as far forward. They have the proper curve in the neck, proper disc spacing, no bone degeneration, proper spinal cord, and they're 3 years older than the previous patient. So people always ask, is that normal for your age? No. If you have the right alignment, at any age, you're going to have less degeneration. If you have a misalignment, it's going to create degeneration. It's like a car with the tires out of alignment. One time I was going on a road trip and I got some new tires. They didn't have the tire balance properly. Like 3 miles into the trip, I had a blowout, right? It had nothing to do with the age of the tires. It was the alignment that caused the issue. So wherever you're at, you want to work toward a healthier spine. This patient came in with severe migraines. She was a patient in a major medical center, and she'd seen all kinds of neurologists, MRIs, CAT scans, but she still had migraines. She was on migraine medication, but she still had migraines. And so when she came in, we took the x-ray. You can see her head is very far forward. The skull and the first cervical are supposed to be parallel, so this is causing a lot of compression here. Complete reversal of the cervical curve, so that's all traction in the spinal cord. That was what was causing the migraines. After 2 months of corrective care in our office, the occiput and C1 are now parallel. The head's much less forward. She's got the proper curve in her neck. No more migraines. At this point, she was unable to attend school. So here, she's no migraines, no medication, and she's in school full time. So if she would have never came to our office, she would have just been known as the migraine patient. But we were able to correct her problem. This patient came in 22-degree scoliosis when she was 9 years old, and it reduced to 16 and then 10 degrees over a 3-year period of time. Now, the interesting thing is her upper neck, you can see in this x-ray, it was way out of alignment. So with scoliosis, the very upper neck is the control center. So not only can that cause headaches and migraines and different conditions like that, allergies, sinuses, but it's also your postural control center. So many times with scoliosis, we'll see misalignments in the upper neck. So as her neck alignment got better over those 3 years, so the scoliosis went from 22 to 16 to 10 degrees. So it was all about getting her upper neck in better alignment. This is an adult that came in with scoliosis. Her curve improved from 24/12 to 13/9 over a month. This patient got into a car accident, had a severe upper neck misalignment. Her leg length balanced out quickly and her posture looked better within the first 3 adjustments. So I re-x-rayed her, and you can see this x-ray was taken 3 days later, and she had a really nice correction. So the younger you are, the quicker corrections are. Usually there's less memory in the body. It's easier to make corrections. This patient came in because they had a posture like this. So from when you look from the side of the lower back, you should have a forward arc. So when he came in, he had a complete reversal of that arc. Now, when I was at chiropractic school, we would never see this in a 7, 8, 9-year-old child. But now with gaming, phones, things like that, we're seeing it all the time. In 2 months, we were able to correct his curve back to normal. This was the daughter of a medical doctor in South Carolina, and we were able to get her below 10 degrees, and this was a 6-month later x-ray, so she went from like a 30-degree curve to a less than 10-degree curve. This was a patient from Palm Coast. They had also a moderate scoliosis, went down to less than 10 degrees. So the correction in our office, the principles that we use for scoliosis, we also use for car accident patients, patients that don't have scoliosis, but they still work to correct the spine as close to normal as possible. We call it mix, fix, and set. Mix is a warming up of the spine to get it more pliable to move back to normal. Fix is the specific adjustment. And then set are exercises to get your brain to hold everything in alignment. Mix, fix, and set. So there's warm-up exercises, cervical retraction to bring the head back over the shoulders of the curve in the neck. Some scoliosis and low back patients will use the Eckert table to affect the discs, ligaments, and tendons. Cervical vibratory traction helps bring the head back over the shoulders and the curve of the neck, helps to restore the normal disc nutrition. Core stem is helping to balance the muscles and get toxins out of the muscles. Mechanical drop is helping with rib deformation. Many times mid-back scoliosis will affect your breathing. This will improve that. And then we do the specific adjustment, and that is based off the x-rays that we take. And most patients that have neurological problems, scoliosis, they have ligament damage in their neck. So most patients, we're not going to do any manual adjustment on them. It's going to all be adjusting instrument or drop table. And then this is, we talked about earlier, the fetal curve. That's that posterior thoracic curve. Most scoliosis patients have a loss of that curve, or it may actually go forward. So we want to restore that. So this is one of the things we do to do that. Scoliosis traction chair. You're placed in a mirror image of your curve, and then the chair vibrates at a frequency to get the brain to hold everything in alignment. So most exercise makes scoliosis worse. So if a scoliosis patient does a pull-up, you'll see them like this. If they do a sit-up, you can actually see their umbilical go like this, okay? So when they just do regular exercise, many times they're making things worse. So this allows you to exercise in a way that avoids that. And then the last thing is what we call spinal weighting, and this helps the brain to hold the adjustment. So the weights are positioned in a way to get the brain to want the spine to be in a better place. So a simple example would be if the head's forward and we put a weight here, initially it'll make the head go further forward, but then your body will want it to be in a better position. So we'll use weights like that to get the brain to hold the correction. So that's the set part, or getting the brain to hold everything in alignment. And scoli-brace is an overcorrective or supercorrective brace. So normal medical bracing just kind of holds your spine in position. This is an overcorrective brace. So if you're in a position like this, the brace is going to actually force you into a position like this. You can move in the direction of the correction, but not in the direction that makes it worse. So we do a structural scan of the body. It creates a hologram. And then we send that to Australia with the posture pictures and x-rays, and they make this 3D corrective brace. It Velcros on the front so you can put it on yourself. There's air holes for ventilation. You can move in the direction, like I said, of the correction, but not in the direction that makes it worse. So this patient was shifted over to the right. In the brace, it takes them to they were shifted to the left. The brace takes them to the right. 12 months later, this is showing the corrected position, and they went from 33 degrees to 11 to 6 degrees in 22 months. So when the spine's growing, you can actually use a brace to change the shape of the bones. Now, in adults, the brace can be used to get the spine more stable, but not necessarily correct it, just trying to improve it and prevent progression. So this patient, when they're in the brace, they go from a 64-degree curve to a 39-degree curve. In adults, the goals of bracing can be a little bit different. So you're not going to have the dramatic change as an adolescent, but it helps with function. So most people, as their spine degenerates when they get older, if they have scoliosis, they want to be able to play with their grandkids, do gardening, things like that. So it allows them to do that, but it might not correct the curve from 33 degrees to 6 degrees. They might get a small correction, but it's going to help them function and prevent the curve from getting worse. But we have a lot of people in that category, and their brace typically is lower cut. Adult degenerative scoliosis affects more the lumbar spine usually versus the lower back, and it's very common for somebody, they may be getting a colonoscopy or a chest x-ray or something, and the tech will say, hey, you have scoliosis. But the patients will say, no, I don't. Well, it's because it just developed. You'll have two segments that will degenerate very quickly, and all of a sudden they have a scoliosis. And it can get worse very quickly. Waiting is dangerous. Our goal is to prevent surgery. We want the spine to be in the best position it can to prevent leading to surgery. There's dangers of infection. You can have hardware break, so you can have screws back out. You can get into a car accident, the metal can break, and then they have to decide, what are we going to do with this broken metal? They're going to have to do revision surgery. So surgeons use the term fresh necks and backs, meaning they want to go in and do a surgery, everything goes good, and it's a one-time thing, they never have to go back. But if you read the literature about these surgeries, it's not a matter of if the hardware will fail, it's a matter if the patient will live long enough. So if somebody gets a surgery when they're 15 years old and they're 60 years old, odds are something is going to happen and they're going to have a revision surgery, which is not good. How do you get subluxations? Well, overwhelming stress, trauma, and toxins. So there's reflexes in your body. When you get stressed out, your brain will actually pull the spine out of alignment. Car accidents, that's easy to understand. When this car has a factory report, it's never going to sell for what it would before, right? So, when you have damage to your spine, we want to get it as close to normal as we can, but it's still not going to be 100% normal. And then toxins. When we have toxins, drugs in our liver, our kidney, it reflexes to different areas of the spine. So let's say your middle back. If your liver is toxic, then it can actually pull the spine out of alignment. So think about like an electrician. You have a fuse box. If that fuse box gets overwhelmed, those breakers are going to flip, right? So just think about the spine as that fuse box, right? So if it gets under a lot of stress, the spine gets out of alignment. So that's called a visceral somatic reflex. The original subluxation, this is a photo taken from a video produced by the Department of Navy teaching doctors how to deliver babies. So there was nothing wrong with this childbirth, but did we see anything there? Yeah, they're pulling the neck, but that's a normal childbirth, right? If everything's going right with a childbirth, nobody has to touch the baby's head. When the apple's ripe, it falls for the tree. Right, you were putting it here. My third child, I delivered the baby. The midwife didn't make it.
Oh, Lord.
And literally my hand was just underneath my wife and he like dropped right into it. If things aren't going well, then they'll even go to using forceps. So it's very easy to imagine how somebody could have upper ligament damage to their neck, and which could later cause a lot of problems. The cause of all disease is your body's inability to regenerate. Balance equals health. When you're in balance physically, chemically, and emotionally, you will be healthy. Fourth attitude, only go to the doctor when you're sick and you better have insurance. Better to go to the doctor when you're healthy and then you won't need insurance. Fifth attitude, it costs money to be healthy. True, however, it costs a lot more money to be sick. 50% of all bankruptcies are caused by medical bills. So the worst case scenario is you can't work, but yet you have accumulating medical bills. So we don't like to use fear as a motivator, but when you're thinking about, do I want to do my exercises? Do I want to eat right? Do I want to make this chiropractic appointment? Well, yeah, you do, because you don't want to end up in that situation, right? Prevention makes more sense. Take care of your incredible body. Looks easy, right? Food looks nice, nice swim, happy, smile. Common signs of whiplash. In the state of Florida, it's a no-fault state. What that means is when you get into an accident, whether it's your fault or the other person's fault, it's going through your insurance first. Everybody has to carry PIP insurance with their auto accident. If you do get into an accident, you have 2 weeks to get to the doctor, and the doctor must say you have an emergency medical condition. Now, there are some very common symptoms that happen from an accident that you might not relate to the accident immediately, and they can be nausea, dizziness, difficulty concentrating, jaw trouble, insomnia, ringing in the ears, lightheadedness. So you get into the accident, you go to work, you're just not thinking well, you're not getting as much done as you were getting done before. And then 2 weeks into it, you say, you know what, I need to go see somebody. I'm going to make an appointment to see a neurologist. You get to the doctor, it's been 2 weeks. Guess what? It's not covered. So you can't use those benefits. So it's very important to get checked and make sure they put it was an emergency medical condition. We've had a lot of patients have issues with this, and sometimes it's just the doctor not writing emergency medical condition. We had a patient that had a history of tremors, had neck surgery, the tremors went away. She had like a multi-level fusion in her neck. She gets into the accident, the tremors come back, right? It's like crystal clear to anybody evaluating the situation that neurologically she was worse after the accident, right? But in the doctor's notes, they didn't say that. They worded it to where we went around with this insurance company for months trying to get them to accept what the doctor said. It was just semantics about the way the word is. But that's the way these policies work, so you have to be aware and know what's going on. So if this happens, you know what needs to be done. 3 phases of chiropractic care. The first phase is relief care. We want you to feel better as quickly as possible. If you're not feeling better, you're not going to be happy, and neither are we. So we want that to happen quickly. The second phase is corrective care. That's where we're correcting the spine as close to normal as possible. And then the last phase is called prevention. When you don't have symptoms, you do not know whether you're in alignment or not. So we talked about only 10% of the nerves have to do with pain. The other 90% are controlling your bodily functions. So if we see that your neurological leg check is off, we know you're out of balance and you need an adjustment. You might not have any symptoms, but something's not working right in your body. That's what prevention is. The neck bone brings the head over the shoulders and the forward lordotic curve into the neck. Most people are sleeping like this, right? So they're bringing the head forward and taking that curve out of their neck. So we take an x-ray after they sleep like that for 50 years. It doesn't look very good, right? So we want them to sleep like this, head all the way back to the bed, curve. These are called prism glasses. So you're looking this way, but you're seeing this way. So you can read in bed, watch TV in bed, use the device without hurting your neck. An ounce of prevention is worth a pound of cure. This little guy had infantile torticollis. So when he was born, his upper neck got out of alignment and his head was like this. The doctor wanted to come in and cut the muscle here to balance things out. The mother chose to bring him in here instead. and you can see she was pretty happy. You can see this is that tummy time, so he's developing that curve in the neck. Prevention starts early. This patient has 6 kids, and they've all been patients right when they were born, and she was a patient when she was pregnant with each of the patients, okay? Each of the pregnancies. So they've all gotten checked within a week of being born. So prevention starts early. Science-based nutrition is some specialized testing we do. It's hair, blood, and urine analysis to detect toxicity and also vitamin mineral deficiency. So many people are taking vitamins, but they don't know why they're taking vitamins. This allows you to take your vitamins for a reason, a specific deficiency or a health problem you have, not just taking it for the sake of taking it. A lot of people could be taking things that they don't even need to take. So, for example, with COVID, they know that the first, and this is one of the things that motivated me to get into this, when they looked at the first people in China that died, they were all vitamin D deficient. And then when they looked at the people that got COVID that walked out of the hospital, they had high vitamin D levels. And I was like, wow. I mean, you hear about nutrition, but this is like cut and dry. Like, you know, how important is this vitamin D? It's really important. So you can check vitamin D levels on one person and they're like 70. They don't need to take vitamin D, whether they have COVID or not. And then you check another person and they're like at 15, they better be taking it a couple times a day. And some people have some absorbing issues. You know, they need to take a high potency
I take
liquid.
vitamin D every day.
Yeah. And is it important? Yeah, it's important because it could be life or death. It's important. So there's other things like that, but that's just the easiest example, and people kind of think about vitamin D. Now, the panel that we have is different from a panel like if you were just go to your GP. So we can't just use your blood work. So we have you do a symptom survey. It goes through conditions you have, medication that you're on. The information will suggest different health problems that you may have. It will tell us metal toxicity, if you've worked around metal or if you've maybe used a well for a long time without a filter on it. A lot of people can have metal toxicity. And then we do the specific lab work. Some of the things are things that would be on a normal GP's blood work, but a lot of them are specific vitamin and mineral findings that would only be on something like what we do. And then it would give a very specific recommendation for that person, and then we would recheck in several weeks or months, depending on how severe the person's health problem is. When you find that we've helped you out, if you let other people know, we'd appreciate it. That's how most people find out about us. Anybody have any questions?
The prospect that you would run that panel specific to different vitamins and nutrients, it makes utter complete sense that everybody would be different. But it really kind of makes the idea of a multivitamin just, that's hit and miss, right? Maybe.
Well, yeah, I mean, it's like, are you Christian or Catholic? Well, if I go to 2 services every Sunday, I'm covered. Either way. So multivitamin, it's just, yeah, it's like a shot in the dark, basically.
Yeah.
There's some things here you don't need. There's some things that you may need. Now, in the process of making these vitamins, there's a lot of things that bind the vitamins together that actually are not good for you. So sometimes the actual process of making the vitamin is worse for you than the nutrients that you're getting. So we give, all our vitamins are a very high level of absorption, you know, and so we try to avoid that. But many times the person is taking single vitamins versus a multivitamin based on what their needs are. Anything else? All right, thank you guys, and have a great night.
That brace, is that something that would be like permanent for someone who's older?
Yes, so typically when we use it in an adult, they have ligament damage. So there's something called spondylosis or lateral athesis. So they actually have ligament damage here, and the bone will slide like this. And so the brace is helping to hold the bone in place. And when they get that, it'll create a scoliosis. So that's the adult degenerative scoliosis. And they may wear it a couple times, a couple hours a day. They may sleep with it. We had a patient recently, he was like 85 years old, and I told her, you know, wear the brace 2 hours the first day, increase 2 hours every day, you know, you can try to sleep in it. So she comes in the next day, she's like, hey, I slept with the brace on, I woke up with no lower back pain. But, you know, but I don't recommend that because it could be a shock to somebody's system doing that right off the bat. But it was just kind of funny that, you know, she was happy with it, but she slept with it. And a lot of people tend to actually wear it more than I even am prescribing because they just feel better with it on. And so when you read the medical literature about adult scoliosis bracing, if it's older than like 5 years, then it's going to say that it's going to weaken your spine and it's not going to help. But that's based on the old type of medical bracing where they're just kind of holding everything together. This brace is an overcorrective brace. So if your curve's like this, it's going to put you in this position, and it has room for your spine to move into the corrected position. So when you're walking and exercising, it's exercising your spine. So we have cases now that are 5 years old where the person had a 52-degree curve. 5 years later, they have a 40-degree curve, and these are people that wear the brace a lot, like 12 hours a day, sleep with it. So the better bracing is shown that it doesn't make your spine weak and get worse over time. It actually makes it better. So that's been a big breakthrough that's only shown up in the literature in the last couple of years.
Okay, so in my case, is that something that I would need to do?
Hopefully
or should-
not.
Okay.
No, so if your curve is less than a scoliosis or a small scoliosis, our goal is just to be able to manage it with what we do here, the mixed fix set, and the home exercises. If something progresses, you know, over time, you know, but it could lead to that, but our goal is to avoid that. You know, bracing is only for people that are, we're trying to avoid surgery, really. So when these people come in with a 3-level degenerative spine with this lateral lethesis, they're looking at either doing that brace or getting like a 5-level fusion of their spine. So that's really gonna get the best, one of those options is gonna be the best result for them. Just like when a child comes in, if their curve's progressing and getting worse, and a lot of them have already been to a chiropractor, then we're gonna recommend the Scoliosis brace for adolescents. But if we can get away with just doing exercises and not doing the brace, that's what we're gonna do. So it's very individualized, you know, and this type of technique that I'm doing now, there's a lot of analysis done on x-ray. I spend a lot of time analyzing x-rays. We take a very specific series of x-rays that you guys have seen from your report, the kind of specific measurement. So it's within a millimeter of misalignment, 1/10 of a millimeter, and 1/10 of a degree of misalignment, where it's that specific. Because we're dealing with other health professionals that are thinking about doing surgery, so we have to be very specific in our measurements. And many times, it's really interesting, our quality of our x-rays is so good in our measuring, we'll have patients that are getting surgery at Nemours or Mayo or somewhere like that, and they say, well, I want you to do the follow-up x-ray. So I'm like, that's a pretty cool compliment, because these are like billion-dollar corporations, and they want me to analyze their x-ray and take the x-ray. So
that's good.
you guys have seen from your own personal reports, it's a very detailed analysis, and I don't think you'll find it anywhere else.
I've never seen nobody break down an x-ray like that, so yeah, I was definitely impressed.
You didn't have that 23 years ago.
No.
Not bad.
Yeah. It is nice. It's very time consuming, but when we're doing the pre and post and we can compare side by side with those exact measurements, it's really nice to have.
When Yvette and I came in for the, when you did the initial analysis and you had it all laid out there, you went through it like telling a story. That's why it took a little bit of time to dig in and look at those results and, cause there's a lot of information in there.
For you, yeah.
For you, I mean, that's a
Yeah.
lot to analyze, right?
That's what, I mean, that's, we're different, you know, so that's part of it.
Alright.
All right, thank you very much, and have a great night.